Hi everybody, welcome. So this is my first time navigating Zoom's like PowerPoint without Caitlin next to me like holding my hand. So I'm going to attempt to do this. And I think, am I sharing it?
Yeah. Yep, we see it.
Oh, wow. Wait a minute. Okay. I gotta move that. Okay. All right. Okay. So today we're going to be talking a little about improving patient comfort. And one of the things that that I have been dealing with, as many of you have been dealing with, is COVID-19, and things are drastically changing. And so I added a couple PowerPoints just to kind of address some of that with patient comfort. I think it's good to think about. It's good to start thinking about. It's good to start implementing in some of our practice, and I think it can be overlooked at times, especially when things are so rapidly changing. I know for us it's been changing daily, different policies, different procedures, and this is such an unknown territory that I think that a lot of different things are changing. And so we'll go ahead and get started. So how are you all doing today? Just taking a breath, being present, thinking about how you're doing today, paying attention to your feelings, your emotions. It's kind of hard when we have a lot of different things going on, a lot of unknown. And so just paying attention to your own feelings, because that's especially going to be how we're helping others as well. I know I'll talk a lot about, but I work primarily with children and parents, and I know parents are feeling a little bit overwhelmed with their children being home every day, all day. And so that, on top of all the other stressors, I mean, that can be very stressful within itself. But just paying attention to how you're feeling. I gotta say today, I'm doing good. Like, I have to say, we've had a lot of patients coming in, and as we're starting to kind of limit that, I've had a lot of patients, and I have to say, like, I've really enjoyed hearing some of their perspectives and how it's impacted their lives, COVID-19. And understanding their different perspectives and really how it's impacting them. And just, I think it's amazing all of the different areas it's impacting. But on top of everything, I just love, because I'm an optimistic person, and so my glasses are always rose colored. But I have to tell you, people's perspectives are really going more towards resiliency, which is great to see, great to hear. There's a lot of things that we're worrying about as healthcare providers, and we'll continue to worry about, but I think it's really great to hear some of the positive perspectives. Almost every patient that I've had, they've had a difficult time with some of their transitions, but they have been able to reframe and also look at some of the positives that have come from this. And so I think that is really, in almost every story I listen to, it's coming across that. And so I think that's really refreshing. Okay, so when you're improving patient comfort, you want to talk about setting the stage. There's a lot of research that talks about, when you're welcoming patients and having your whole office set up, right? And so I've read some research on, different paint colors for your office, and there's a lot of research out there about different paint colors. So if that's your interest, then go for it. But with the different paint colors, to how many things are in your office, to how your office is organized, I mean, naturally you want to make sure that we're taught, as in our field, to always have an exit. And I think that safety is with the population we serve is definitely something to consider, but you also want it to be welcoming, and so balancing that out is important. But I have to say, regardless of the paint and the things that you have in your office, I think that if you have that relationship and you build on that and you have that person's trust, which is what we'll talk about a little bit more, I don't think it matters what your office looks like, or what color it is, or how big it is, or where it's at. And I think that, part of what I have experienced in my profession is I've done a lot of in-home services, in-office services in different areas. And I'm a firm believer, and I know I've said it on here before, that if you can learn to do therapy in a in a car, in the most distracting settings, then I don't think that the color of your walls really matter, although literature does say that it improves mood and impacts a patient. But when we're talking about patient comfort and relationship, I think it's the relationship that's the biggest. When you're looking at welcoming a new patient, I think that one of the things to think about is the process and to explain your process. Your process is important. What you're doing is important for patients to know. We're dealing with populations who have, you know, in the rural area that we serve, we have high trauma populations. And so always having things predictable, kind of laying out for them what we'll be doing and what that process looks like, can really help minimize, you know, them feeling anxious. And so just remembering to explain that process, I think, is important. That's hard in your day-to-day life. I know sometimes I forget to explain that to a fool, and then when a patient asks me a specific question where I'm like, oh yeah, that would be nice for you to know, it makes you think we have to slow down. And so we have to provide this environment where they are feeling safe, they are feeling informed. It's really important. Offering refreshments. I know plenty of individuals who offer refreshments. Food is a big key point in literature that shows that when you share food with individuals, it definitely helps reduce tension and anxiety. And so that's definitely something that you could incorporate if you're able to, if your facility allows you to. And so that's always a welcoming point. I know working with children, my office setting does impact treatment as far as stimulation. And so I do need to reduce stimulation. I have a bookshelf with toys on it, and it is so distracting for some of my patients that I prefer a closet. And so if I need to reduce stimulation, I'll do that in our playroom that has a closet that you can lock. Locking it has been important, especially many of you know, as I've talked about, that I do parent-child interaction therapy. And locking that facility for some of our kids who are hyperactive with disruptive behavior problems is really important, because they can get distracted by that and pull everything out of that closet. And so that's at least 15 minutes of our time when we begin session. And so just being aware of your environment is important, being aware of what's available, especially if you're working with children, what they have access to. That's going to be important. One of the things that I've done since, you know, COVID-19 has become such an issue is I have made antibacterial, hand lotion available. I also, one of the interesting things that I have found is I'm still seeing a lot of my trauma kids who need to be seen, and especially as they're processing really difficult. I have two that are right in the midst of processing really difficult trauma. But I had brought masks to my desk and just made it available for anybody that might feel more comfortable wearing one if they prefer. I have allergies, so I cough, and I had a patient that asked me to wear one. So I just make it so that I can improve their comfortability in being here. My trauma patient last night, I thought it was really fantastic. She came in very nervous, didn't want to touch anything. When she saw the masks, she put it on and she was completely fine. She relaxed. It helped her feel more secure for whatever reason. It wasn't on right. She wasn't using it right. Neither of us have any symptoms, so she was fine, but it just helped her feel more comfortable. It's kind of the same thought as, sometimes when kids are afraid of saying something or just embarrassed, they get very embarrassed of some of the situations they've been in and they hide. It's just like giving them that space to hide, right? Or giving them sunglasses. Sometimes I'll give them sunglasses to wear where they feel like I can't see them or they can't see out. So it just makes them feel better. Engagement. So this is the typical piece that we talk about all the time. But it's really a good refresher and reminder. I know for me, these are things that are like 101, right? You learn all these from the very beginning, but it's really nice in times of these to just slow down and remind ourselves of these pieces and these aspects that sometimes we lose sight of when we get so busy. I have to say, I was just in a meeting, and one of the things that we talked about appreciating through everything that's going on is the ability to just slow down a little bit, and that is very nice. Um, so you want to be warm, respectful, active listening. I think sometimes, we talked about in our ECHO presentation a while ago, we did therapeutic alliances and engagement. And we talked about, taking time to build these relationships from the beginning and how we have to actively listen. And I think sometimes we feel the pressure from whether it be supervisors, insurance companies, parents, patients themselves to kind of get to the solution, right? To fix this problem, and so you almost feel pressured to do that when in reality we need to step back and just listen to what's going on, take our time in building these relationships, and then continue to move forward with treatment as we do that. We're not going to get anywhere if we don't build that therapeutic alliance from the very beginning. So it doesn't matter how much effective treatment you're providing after maybe your first session. If you didn't build that therapeutic alliance, you're going to come right back to the beginning of that. So it's really important to build that relationship, and active listening is a big part of that. Starting where the client is, and so this is just meeting them where they're at. This is really important, especially with children, and many of the times, a lot of my work with parents is getting them to meet where the child is at. So whether it be social emotionally, developmentally, wherever it might be that the child is falling, I need parents to meet them where they're at, because we're not going to get them to process and understand things unless we do it on the level that they're at. If they are 8 years old, but they're processing and social emotionally understanding things as a 4-year-old, I can't tell this child to act like an 8-year-old, because they're never going to move forward, right? We need to meet them where they're at. Gaining trust, taking responsibility. So I always own my mistakes, even when it's not my mistake. Sometimes I own it. But it's really important to take responsibility. I think this is a I've been tested several times with this, especially, so kids with trauma will test you with taking responsibility all of the time. If you don't remember something or you forget something, trust me, they remember and they will test you with it. I've also been tested when I worked in the prison with this. Taking responsibility is big with the inmates. You'll gain more respect that way. And amongst substance use disorder population, they test me quite frequently, and taking responsibility is big. Familiarity is important. I always prepare, so I try to prepare my patients ahead of time if things are going to change within the environment they come into. So I see patients in the office. If they're coming into my office and things have changed, I make them aware. If I've gotten new toys, I make them aware. I had a kid that I was seeing for trauma for 1.5 years, and he was doing well. And I actually switched offices. I moved offices, and I didn't get to see him before I moved offices. It happened very fast. And so I told him in the waiting room that I had moved offices and that I was in a new office, and you could just see the anxiety build up in him. And he got so nervous, and he said, well, what do you mean you moved offices? Where did you move offices? How long are you going to be there? And all these questions, right? And as soon as we got into my office, he noticed it was the same furniture and the same toys. And he took this huge sigh. He said, oh, you still have the same everything. And I said, I do still have the same everything. It's just a different office. And so really taking some of that into consideration to improve their comfort is important. It's just not something that we always think about. So I think it's really important. And that just goes to being sensitive to some of the differences that are amongst the population that we serve. And so that's really important. Engaging children and adolescents. So some of the big things with engaging children and adolescents so that we can improve their comfort levels is, like we talked about, the piece that I talked about with building the therapeutic alliance with children is playing. There's tons of different therapeutic games, but initially it's not about the effective treatment that you're going to be providing, it's that relationship. And so playing something that they choose, that they want to. I allow children to kind of take the lead. I follow their lead, although I am very informative as well. So I make them aware that we're not going to play this every session, that we're going to move towards other things. And so, and I don't tell them when until I know when. So with trauma kids, if I'm just building a relationship, it might be them taking the lead. A lot of them end up it depends on where they're at with their motivation to change. Some of them are ready to talk then, some of them are not. And so some of them are doing that testing, looking for consistency. And really it's just about, like I said, building that relationship. And so I'll play with them until I've determined that they're able to move forward. And when they're ready to move forward, that's what I'll say. Next session, we're gonna do some tough work, and we talk about it. And usually I set up a reward system of play because we started off playing. But following their lead, that builds trust, that builds a positive relationship. It opens up that interaction during play. Voice and choice. And so giving a child, an ability to have a voice in their treatment, and also to make some choices on their own. Now, this doesn't start, this is really important around 8 years old. You're looking at 8 years old, it's important for them to have a voice in what's going on, right? They have to have a buy-in. And so you're really trying to build that relationship so that they have a buy-in, but also to start to have choices. This is really big amongst teenagers, but it does start 8 and 9 years old. So start to have choices. Might be limited choices, but still to have choices so that they feel like they have power and control over the situation. Finding relatable topics are always big in making patients feel more comfortable, something that they can connect with you. I mean, that's just with all relationships, right? We love it when somebody understands what we're talking about, when they like the same things as us, when they thought something was just as funny. And sometimes those are really big. Motivate, so you want to continue to move towards motivational interviewing and motivating them towards change and providing support. Sometimes it's just about being that listening ear and supporting in order to engage and then moving towards treatment. So understanding stress during disease and outbreak, when you're looking at this comes straight from the CDC, and I have a link towards the end. It has great resources, great direction on giving parents, children, great interventions you can utilize. So there's tons of resources out there. But talking about it, understanding the stress that some of our patients might be having is fear and worry about their own health, health of loved ones has been coming up, changes in their sleep and eating patterns, difficulty sleeping or concentrating, worsening of chronic health problems, increased alcohol, tobacco, or other drugs. I think this is important to acknowledge right now, because as we continue to assess individuals, we have to take this into consideration as well. And so this is an important piece to understand and acknowledge as patients are continuing to be seen, whether it's telehealth or face-to-face. We have to understand that this might be some of the stress and fear that others are experiencing, as we are ourselves. And so taking all of that into consideration. Core competencies for comfort. So you want to foster hope, gain that mutual respect through that relationship and therapeutic alliances, building that partnership, and appropriate self-disclosure. So that's really important. A lot of the time students will ask me when self-disclosure is appropriate, when it's not appropriate, and I think that can be a slippery slope. So here's the definition in social work for self-disclosure: involving statements expressing one's reactions to a client's behaviors or progress. In a statement like, I think it takes a strong person to identify how increased stressors have impacted their lives, right? You're still focusing on them. You're telling them how you felt about a situation, as long as it's an appropriate statement. You don't want to tell them, I think you really could have been stronger. I really think that could have helped you a little bit more, and it could impact your life differently. Like, not really motivating, right? You want to look back at what the core concepts are. You want to foster hope. That's really inappropriate to say. So you want to make sure that you're making appropriate statements. And self-disclosure, describing personal struggles or experiences that have been similar to yours. I was a single mom too. I know how difficult it can be, right? That's an appropriate self-disclosure statement. You don't want to go too much into your situation because it's about them. And what I encourage students all the time is, if you feel like it's a statement that can help them, then make it. If you feel like it's a statement you have to make for yourself, don't make it. And so really looking at how it's going to help them and keeping it minimal. So you want to almost like, and a lot of the students that I work with, they're already working with children. So we talk about keeping it age appropriate, right? I tell them, like, you want to keep it as if you're talking to like a toddler, so that you're not expressing a whole lot of your information, but you're just being very brief and meeting that connection. Because here's what we want to focus on. This is our message. It's not about us, it's about them. We want to provide genuineness. We want to show them that we're genuine, that we have some of these experiences. We want to give them respect, and so that they don't feel judged, that they're accepted. We want them to trust us, building that relationship, being consistent, taking responsibility, right? That's building all of that trust. We want to make sure that we are providing empathy and not sympathy. We want to make sure that we're giving more empathy. And we want our connections to be purposeful. So we're here to treat individuals. And so we want to make sure that the connections we're making are purposeful, but we're human as well. So we're going to have emotions around specific pieces, just keeping those kind of in line, and making those connections purposeful. So conveying empathy is a big thing. We want to validate clients' experiences, even if you don't necessarily agree with them, right? Because it doesn't mean that they're wrong, but we want to try to validate as many experiences as we can that are positive for them. We want to validate emotions that they might be experiencing as they move forward to, if they're moving to build more of a healthy perception of that. Being emotionally attuned to the client's experiences. So verbal and nonverbal cues, communication, using words that accurately reflect feelings, avoiding sympathetic statements like "at least," or "that must be terrible," or "I'd feel the same way as if I were you." Because we don't know at times, and so we don't want to pretend those things. All right, so here is a video. I don't know, maybe I won't be able to play it. So have you guys seen this Brene Brown video on empathy versus sympathy? This is my new favorite video. It's so super cute. But turn your volumes up and listen.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, "I'm stuck, it's dark, I'm overwhelmed." And then we look and we say, "Hey, I'm down. I know what it's like down here, and you're not alone." Sympathy is, "Ooh, it's bad, no, you want a sandwich?" Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with "at least." And we do it all the time, because you know what? Someone just shared something with us. It's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now. I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
So what do you guys think about that? Anything come up for anybody? Anybody silver line?
I'm here. I would say for me, I think it takes a special person to be that person that can have the empathy and knows the right thing to say. And I think we can all work to be that way. But for me, I'll just speak for myself. It's not always natural. But it would be nice to be able to develop that skill.
Yeah, thank you for sharing that. Yeah, that's, and I think that you're absolutely right. And, you know, when you look at, even when you look at some of my slides, right, it has trustworthiness, empathy, and I think we always see those pieces, and it's just kind of expected that we do empathize in our field. But it is a skill that sometimes you have to work at, and it's not, you don't always have the right thing to say, and sometimes that's okay. Sometimes that silence is okay, just letting them know that you're there and that you support them. I know for me, I mean, I catch myself silver lining all the time. So I do have to really work at that. I have to work at the fact that, you know, it's not my job to be here to fix this. It's my job to help them organize these thoughts. And so, you know, sometimes you feel that pressure to do that, but it's not our job, right? And so I think, you know, we always go towards fixing it and coming from the right place, but we're saying the wrong thing. And so it is definitely a skill to work out. So there's a couple different practices to focus. I know for social work in specific, the empowerment-based practice, it's a client-centered practice. Both actively participate, the patient actively participates, identify their own opportunities, how different areas can empower them, and it's our job to kind of provide some of those when they don't know those resources. So giving some of those resources are important, but them making those steps to move forward to utilize those resources. And sometimes our patients need help doing that. I try not to do for, but to do with. But sometimes it takes sessions to do with, and sometimes it takes role plays to help them do with, but it empowers them in the long run to do for themselves. And I think that can be really helpful. Mutually agreed upon goals. Many of the times we set goals for patients that they've not set for themselves, that they kind of come in and they talk about things. We might talk about a diagnosis or what's going on, and they're like shaking their head, yeah, but they don't really make these goals, so they don't buy into them. So it's really important to make some mutual goals that we all work on together. So engaging in reflective practice, I think is, you know, really big, just kind of reflecting their own words to help them figure out things on their own. But again, I work with a population that reflective practice is primary, so totally biased in saying that I completely agree with this. And the strengths perspective. So this involves a focus on strengths versus pathology, behavior as a symptom. So you kind of have this just symptom, but there's something driving it, right? And then a deficit model versus a strength-based model. So really focusing on the strengths and not the deficits, but being realistic, right? So we're not painting this great picture, but we're really pulling from the strengths that are there. That's really important, to be realistic. There's a lot of research that's coming about that shows, you know, when you focus completely on the strengths and kind of ignore some of those deficits, that it can be damaging when you're not realistic. So it's important that even though you do focus on the strengths, to still be realistic. Don't forget about those pieces. Many of the times times when I have students that are focusing on a strengths-based perspective and they didn't help a patient gain insight on other areas of deficits that were really impacting, they're like, I feel like I should have. And so we talk about how, yes, you still can. And they're like, well, I feel like you have to be so positive. Strengths don't mean positivity. It means just focusing on what they can do, right? But still looking at some of those other deficits. So, you know, when you're looking at improving patient comfort, you want to also address some of the natural barriers that you're going to come across. And in the rural areas that we serve, it can be really trying when there's lack of resources. There's lack of transportation. So, you know, I know for many of my patients, transportation is a huge stress for them. They stress about what time they'll get here. They stress if their transportation will come. They stress if they can't get here. They stress when they can get here next. And so transportation is just a huge barrier. And sometimes for some of my patients who get very anxious about transportation or the fear of having transportation, we spend at least 15 minutes at the beginning of session just either kind of calming down or preparing for that. And so it can definitely be a barrier in treatment. Trust is a huge barrier, right? How's trust a barrier in a rural area? What have you guys heard? Anything? Nothing? So a lot of the literature shows that, you know, trust, and just the same thing we hear from our patients, right? Everybody knows everybody. We're in small areas. You know, if I tell you this, then you're going to tell your aunt who knows this person and knows that person. And so that can be a huge issue. Trust as in exposure to new places, new people, new things. That's a huge trust barrier as well. I know for me, when I first started working in West Virginia, that I love, and I've always been a part of West Virginia, but I came from Pennsylvania, and, you know, when I first came here and I was new to the whole system, I would say, you know, I'm from Pennsylvania, then I would just seriously get immediate people who just like cut me off and stopped coming to me. So sometimes coming from an outside area, right? The other thing that a lot of my patients have talked to me about is you trust your own, you keep it within the family, you keep it within your community. So trusting providers can be very difficult. So that's a big piece. And stigma of mental health is still very real. It's still very much out there. I have a lot of teenagers that I see that are always telling me, like, I don't understand why they won't just get a therapist. Like, it's no big deal. And so we have to talk about stigma. But I think we're doing a lot to overcome that, but I still think we could do a lot more. So techniques, therapeutic techniques that we talk about is empathy, doing some reflective listening. So if you have a difficult time with empathy, sometimes just reflecting what they're saying can be really helpful. Goals based on their values and current behaviors. So you want to assess goals, reevaluate, kind of look at that. I try to look at it each and every session to see where they're at. I usually give my patients homework, so I'm always looking at that. Avoid arguing. I know this is like a golden rule. You don't want to ever argue with your patients, but you know, I've known of some people who have gotten into arguments. You want to definitely avoid arguing. That's uncomfortable and inappropriate. But adjust to resistance. So having that resistance from patients and just kind of adjusting to it. It's difficult as providers at times for patients to be resistant. It can be frustrating if they're continuously resistant, but moving towards motivational interviewing and utilizing some of those skills to help you move back into treatment. Sometimes you have to just take a step back. There are other things going on, and you have to meet the patient where they're at. So back to that very beginning slide, meeting them where they're at, and just adjusting to that resistance. I think another thing is just, you know, just being comfortable with ambiguity. I seriously just butchered that word, but you know what I mean. Because here's the thing, I usually come up with 3 hypotheses when I do an intake, and just kind of identifying 3 different areas. And really, again, it's up to them where, you know, it has to be a mutually agreed upon goal. And so really whichever one best fits them, but I could be wrong going into that. But, you know, and I think for psychiatry, it's a little bit different because your medication is based on those symptoms. And you want to be right about that, but you're still, I mean, you still could be wrong. There could be other presentations going on, and just feeling comfortable with that because it happens. Support, provide support and identify natural supports. This is a big one that I do with patients. You know, I have patients that come in and they're like, I have nobody, I have no supports, I have nobody I can talk to. I usually do an eco map with them, or, you know, some sort of activity to identify different supports. Once you start to look at who's in their lives and who's around them, they start to identify more healthy supports. They also identify unhealthy supports, and maybe we start talking about how to create some of those boundaries. But many of the times at first hand, they'll say, we don't have anybody. And a lot of the times we can find some people. So a lot of the information, so you know, this I got from 0 to 3 website. So for those of you who've heard me speak before, I talk a lot about 0 to 3. And if you've not explored 0 to 3, you should do that. It's spelled out ZEROWTOTHREE. If you go on to that website, they have tons of great information and resources for parents. And so I think that's really beneficial. But teaching parents to pay attention to their feelings. I've been talking with parents about, imagine a child's behavior as communication. What are they trying to say to you right now? And making time for self is really important. I talk with parents about that all the time. So these are just some techniques to kind of help through the current situation that we're dealing with. Not all children and teens respond to stress in the same way. So identifying some different indicators that might show that they're feeling a little stressed with things that are going on, some changes in behaviors, changes in the patterns of interactions. You know, now that parents are with children all day sometimes, looking more at their eating habits, their sleeping habits, and just kind of reviewing some of this with parents so that they can identify that within children as well. And this is actually some of the same indicators as how to deal with children who've been exposed to a disaster. So it's really some of those same trauma-informed care. How to help parents support children during this. So this comes from the CDC as well. Taking time to talk with children or teens about COVID-19, what it's about, so they can ask questions, parents can answer them, focusing on age-appropriate answers, you know, things that they can developmentally understand at that time. And sometimes talking about those and role-playing them, you know, with the provider can be helpful for parents. And we talk about that, we role-play. I had a parent in here the other day that was just so afraid because their child's asking questions because they're curious, they're hearing a lot. And we talked about, you know, one of the pieces in here, I don't know if it's on this slide, but another slide talks about limiting media, and we talked about then limiting media. Mom has high anxiety, so she's been watching tons of news and so we talked about limiting that, right? And if you feel that urge to do that, how often do you have to do that? Where can you go to do that so that you're not with your child? But just having age appropriate, there are tons of different comics and ways to explain COVID-19 to your children, and to help parents do that. There's little storylines. So like I said, 0 to 3 is a great resource for that. Reassuring children and teens that they're safe. Let them know it's okay to feel scared and upset and that it's unknown, and dealing with your own stress to cope with that. Oh yeah, it does say limit exposure to news coverage and media. So yeah, try to keep up with regular routines. That's really important. Schools are closed right now, so looking at creating a routine within the home can be really helpful. When things are predictable, kids feel safe and secure. So the more predictability we can give them with a routine, the better off they are. Having learning activities, even if they're not like great learning activities that they would have in school, you know, anything to continue to stimulate their brain activity is important. activities for fun, relaxing activities. You know, we had a, now that here, one of the things that have changed is everything has gone to Zoom. And so all of our teachings and meetings and interactions are done through Zoom. And so one of the things in the supervision one that I'm talking about is always through Zoom. But so one of the things that we were talking about in our infant and early childhood mental health task force was looking at the resiliency pieces from this, looking at, I mean, we talked about where some of the areas of concern are and where some areas that we're going to start addressing, but we also looked at some of the resiliency pieces. We talked about how, you know, how much more family time is going to be spent, how people are being forced to kind of slow down and spend time with one another. We talked about, you know, children activities are canceled. So we talked about how, you know, children are scheduled. One of the things that have changed, and I actually read this in a book a while ago, but one of the things that have changed from past parenting to current parenting is, you know, kids aren't sure what to do with their time because their time is constantly planned out for them. They go from activity to play dates to this to that. Parents structure their time completely. And so now they're left with a lot of unstructured time, which is great for social emotional development and them getting back to kind of processing that on their own. And so that's a really positive piece for kids. So looking at some of that can be more positive. Be a role model, talking with parents about taking breaks, getting plenty of sleep, still sticking to their routine, right? Exercising, eating well, connecting with friends and family members, even if it's from a distance, still having the opportunity to do that. 0 to 3 has some great resources on how to make the most of screen time, what you can do from a distance, how to interact. Grandparents, you know, they talk a lot about grandparents' interaction over screen time. You can have the same book and read to one another. So a lot of great pieces on there and great resources. I love this picture. Like, this is just one that I throw into everything I possibly can, right? It just depicts therapy so perfectly, and this is what we really do. Individual self-care. So I talk with healthcare providers all the time about just remembering that, you know, we're dealing with a lot of kids who are exposed to trauma and stress. We're dealing with a lot of parents who are exposed to trauma and stress, adults, teenagers. And so just remembering that, you know, secondary trauma and stress is a real thing. Just being mindful of that, increasing your awareness of that, how it impacts you, and taking care of yourself, because it's really important for us to take care of ourselves in order to connect to others. We can't wholeheartedly connect to others unless we're taking care of ourselves, and that's really important. So this was also on the CDC. So this is a way that, you know, just another self-care piece. For providers to also take care of themselves, make that time to unwind, even if, you know, some of us are given some time to unwind, but sometimes it's busier. And I mean, I thought my time would slow down coming in on Monday, but it just got a little busier because we're changing a bunch of different things. And so just taking that time to take a breath and slow down. This is the website that I found all of those resources from the CDC on. So you guys will get that with the PowerPoint. And do you have any questions?
Everybody feel free to unmute yourself. You probably are muted. And Amanda, that was wonderful and perfect. Thank you.
Thank you. I know one of the things with the new Zoom is that I have to keep my door shut. It gets hot in my office.
I have a question about staying active and exercising when you're supposed to social distance and it appears not go outside.
Yeah.
I'm telling people to walk in place, but is there something else that people could do?
So I think that, you know, there's really, I mean, I've been encouraging people to go outside when they can. You know, a lot of my patients live in rural areas, so it's very far and few between houses. And sometimes it's walking the yard or, you know, their farm or whatever it might be. But there are tons of apps that are providing like I would kind of look through. There's tons of different apps that are providing free memberships for exercise. There was a mindfulness app that I can't remember. Lauren, do you remember the name of that mindfulness app?
I think it might be Headspace.
Oh, that's what it is. It's Headspace. Yeah. That's an app that's free now, and doing just some of those exercise pieces. We've talked about, we just talked about in our meeting, families not having access to internet all the time. So we talked about how some resources are becoming available. So Comcast is offering 2 months free. Spectrum is offering something, but I can't remember what. And then there's, Lauren was saying that schools are offering for you. Was it you, Lauren, that said that about the schools? Somebody said about schools going to, parents are welcome to, schools are encouraging that parents, if they need to access the internet, to go to the parking lot of the schools in their cars, and they can access internet that way. And so, there's a lot of different opportunities. I mean, they can't exercise in their cars, but other ways to access internet. But good question, yeah. Anybody else have ideas or hear of any resources that are available? I know a lot are coming available, and there's just changes all the time, so.
Well, I had a comment about sort of the empathy issue from earlier too, not directly related to COVID-19, but I've shared this, I guess, with trainees over the years, and I find it still really helpful advice. As I get better at what I do with my job and medicines, I still find that most of my mental energy goes into sort of in that therapeutic process. And Amanda, I don't know if this still applies to you too or not, but I spend an enormous amount of time still in my own head, sort of doing kind of role play and saying it to myself before I say it to the patient. In fact, that still occupies most of my energy. The decisions about what to do are so easy now after a time that I still want people to know that those of us that are like, over a decade in, still put forth a lot of that mental energy in that whole like connecting. Like I literally run through scenarios in my head before I say it to a patient, how I'm going to say it, and think about how they may take it. That's actually where most of my clinical skill is in continuing that empathy process. And I don't think that's something that's getting less and less. I'm getting better at it, and it's maybe going a little faster, but it still occupies a large part of my time in that connecting, about thinking about not what I'm going to say, but how I'm going to say it for that specific patient to take it that particular way. And you have to adapt that for every patient. So if you still are spending a lot of time doing that, that's still what all of us are doing, and I think that's important.
Yeah, thanks for sharing that, because I definitely think a lot of people still do that. I think I definitely think that's a skill that we're always working on, and we could always be more aware of. I don't necessarily struggle with that piece, but what I struggle with at times is just thinking of where I'm going next and missing that, right? And so a lot of the times, if therapy isn't effective, or patients just aren't making movement, I first go to evaluating, am I connecting? Am I being empathetic? Am I building that relationship? And sometimes I'm missing those pieces because I focus a lot on treatment, right? And so for me, it's a little different. Like I have to stop myself to do that. So it's, and I think those are two ways that you continuously work on empathy.
Amanda, I had a question, just more about like best practice in this capacity, but would you have a way of asking people about their cultural or religious backgrounds or something, or just let them bring it up themselves? I know this discussion today was about, creating a comfortable place, and where that kind of plays in.
Yeah, so I usually I usually follow their lead on that. And I know that if they specify, or if there's a specific background they come from, or there's a specific religion that they might come from, or a cultural belief that I know of, then I absolutely address it. And if I don't know of it and I know it's important to them, I also ask. I think it's important to ask and be aware of. You know, I had a patient that I was not aware of the impact of their culture and their religion within their culture, and it had a huge impact on them. And when they had brought it up, I specifically asked for them to educate me about it because I did not know about it. But apparently, you know, and I think I shared this case before, but they had gotten, their son was diagnosed with autism, and their religion and their belief is that that means that the mother has done something in her past life, and she has sinned, and so it caused her to spiral into a severe postpartum depression. And so you know, just not knowing that at times, I think we can be causing some damage that we don't realize. But yeah.
Thank you. And the sympathy versus empathy video was precious.
I know. I totally silver line sometimes. I gotta watch doing that. I mean, not quite that drastically. I'm
Right.
like, oh, that's bad.
Yeah. Does anybody else have any questions? We have about 5 minutes left. You're welcome to unmute or chat, and I'll ask it for you. And as always, you can email us to follow up if you have any questions afterward.
I'm so excited I shared the slides too.
Yeah. You're a pro. You don't need me anymore.
Oh, I don't know about that, Keelan. That's a little far.
Oh, don't worry. I'm going to need you next week. I have no idea what I'm doing.
I'll be there. We could social distance in your office. It's big enough.
Right. I think you have all the heat. I don't have any of it. So.
Well, I prefer to be there, not here.
Well, in the next minute, Lauren, do you want to tell them what you're talking about on April 1st?
Yeah, so I'm going to kind of stretch out sort of what was a shorter presentation on psychotropic prescribing, but I was going to kind of start with some foundational things about kind of basic ways that a child and adolescent psychiatrist thinks regarding pediatric prescribing for mental health issues. And I have like a whole background with 15 key principles that we're going to do. And then I'm going to kind of build on that to do different classes of medications at future things. So we may cover like ADHD meds one block, antidepressants another block, mood stabilizers, antipsychotics is sort of the plan probably going forward for my next 5 or 6 lectures, if that sounds good to everybody. But we'll do the foundational, what to know, all this tricks and secrets of how child and adolescent psychiatrists think next week or 2 weeks from now.
Perfect. Thank you so much. And everybody, with that in mind, you're welcome to submit a case or a question in the meantime. You know, the social distancing doesn't keep me away from a computer, so I'll be on it, I promise. And everybody have a wonderful week and enjoy yourself as best you can.
You too.
And thank you,
Bye,
Amanda.
everybody. Thank you.